6 ways you can help a loved one with rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune arthritis that can cause a lot of pain and stiffness of the joints of the body when it is active and not yet under control with treatment. In this video, we are going to tell you about 6 important things that you can do to help and to contribute to a loved person who has rheumatoid arthritis, especially when the disease is still active and not yet under control with treatment. This is Dr. Hatem Eleishi. I'm a professor of rheumatology at Cairo University in Egypt and the director of Tabibakom website for online consultations. What we present here is a series of videos about the different types of arthritis and how to manage them. But before we start, please make sure that you subscribe to my channel and activate the notifications button. You will find here a lot of videos that will help you with many types of arthritis, how to understand them and how to manage them. Number 1, help them with their daily tasks. Help them with the basic tasks of daily life that they should do. Rheumatoid arthritis, if still active, makes many activities of daily life painful and difficult. Where possible, you can help them with some of those activities or take over and do some of them yourself. Number 2, a pleasant smile and a pleasant attitude, please, all the time. More important than helping a rheumatoid arthritis patient with their daily activities is to make sure that whatever you do for them, you do it with a pleasant smile and a pleasant attitude. This is one of the greatest kinds of support you can give to a rheumatoid arthritis patient. Don't complain. Make sure you don't complain or refer to the rheumatoid arthritis as a burden to you or to the family. It is a burden to the family at some level, of course. The healthy definition of the burden here is that someone we love is in pain or is suffering. Expenses you pay and efforts you make to help and support them should not be the main or the big definition of the burden here. A rheumatoid arthritis patient has enough pains and sufferings to face and deal with when the disease is active. They don't need the extra pain of feeling that they are burdening somebody. Remember that if patients receive good treatment and really get the disease under control, they will be much better and will likely to return to a near normal life, if not normal life. So any burdens, hopefully, are likely to be only temporary conditions and not permanent conditions. Number 3, adapt the house to the needs of a rheumatoid arthritis patient. Make sure that the house is well set and adapted to their needs. One example is doorknobs, water taps. Get the brands or the styles that are more rheumatoid arthritis patient friendly. There's a long list of items that can be brought or adapted to the needs of a rheumatoid arthritis patient. We will prepare a special video of those items very soon. As I mentioned this point, I remember what one of my rheumatoid arthritis patients once told me when she was expressing how grateful and thankful she was to her husband. This happened many years back. When they bought a box of mineral water, her husband was in the habit of opening the cap of each bottle in the box to break that plastic seal and then closing it again, so that she would not have a hard time opening those bottles later and breaking their seal herself, as it gave her such a hard time and frustration sometimes. Number 4. Number 4, accompany them to their doctor. Accompany them when they go to the rheumatologist for a follow-up visit. You don't need to be with them in the doctor's office always, but at least accompanying them and waiting for them in the waiting area every time they go to the doctor is a tremendous support that you can give to them. They will appreciate this always. Number 5, join them in doing exercise for rheumatoid arthritis. There is always some kind of physical therapy or exercise therapy that can be done for every level of activity of rheumatoid arthritis. When the disease is more active and inflammation is intense, physical therapy can help. As the patient's condition improves, he or she can rely less on physical therapy programs and can progress to doing some exercises that will be prescribed, of course, by their doctor or their physiotherapist. This will always include aerobic exercises, strength training exercises, stretching, or water exercises. They help to reduce inflammation, strengthen the muscles, strengthen the bones, and improve the cardiovascular health. One area where you can really help and contribute to a rheumatoid arthritis patient is to join them in doing those exercises. On one hand, this will encourage them, of course, to participate on a more regular basis in their exercise programs, and on the other hand, it will also be a great bonding time for both of you. Also, yoga is another good option for patients with rheumatoid arthritis. You can join them in yoga classes. Yoga instructors can modify some of the yoga poses to help patients with rheumatoid arthritis. It can be a good stretching and strengthening and relaxing activity for rheumatoid patients. And since we mentioned yoga, which is a combination of exercise and relaxation, why not also mention meditation classes, which are another great chance to bond with them and to gain the benefits of those sessions together. Number 6, spend time with them or take them out. Keep showing them that you care by spending enough time with them, or take them out if this sounds like a good option or a practical option. Finally, rheumatoid arthritis can be a tough diagnosis and a burden to your loved ones, but you can definitely do a lot of things to lessen that burden on them and even to bond more with them. If you have a close friend or relative who has rheumatoid arthritis and you know more ways to help them and to contribute to their betterment, please let us know in the comments. We are all eager to know new ways that we can use to help our loved ones. Thank you so much.